At age 4, a young girl was involved in a severe car crash. She survived the impact, but the blunt force head trauma she sustained resulted in a permanent injury. For the next 13 years, her clinical reality was no light perception, or NLP. This is the most severe form of blindness. It means her eyes could not detect a single photon of light. This diagram shows the complete visual pathway, a neurological highway from the retinas to the occipital lobes. Vision requires this system to remain intact. Blunt force trauma can sever connections at the 10 junctions highlighted here, instantly cutting off visual signals from the brain. Once chronic scar tissue or fibrosis sets into these sites, traditional medicine has no surgical or pharmacological way to reconnect the pathway. Because conventional repair fails, restoring her sight required an entirely different approach, using her own biology to regenerate the dead neural pathways from scratch. The researchers focused on autologous telomerase-positive stem cells. These cells contain the telomerase enzyme, which acts as a biological clock that constantly resets, giving them the potential to divide and multiply indefinitely. These cells also possess a homing mechanism. They act like a biological GPS, actively seeking out and migrating toward areas of tissue damage. This chart visualizes why standard stem cell therapies often fail to reach the brain. Traditional mesenchymal stem cells are 15 to 30 microns wide, like a basketball. Meso-SCs are like a volleyball. Pluripotent stem cells are 6 to 8 microns, like a baseball. But totipotent stem cells are microscopic, 0.1 to 2 microns, equivalent to a tiny marble. This microscopic size is the key. It allows TSCs to navigate through anatomical barriers that are physically impassable for larger cells. To begin the treatment, doctors isolated these tiny TSCs from the patient's own blood and placed her in a reverse Trendelenburg position, with her head tilted back so her nostrils pointed upward. This cross-section shows the olfactory system. Instead of an IV, tiny TSCs were applied as nasal drops. They crawled between olfactory receptor cells in the nasal passage, slipping through the porous cribriform plate. This bypasses the blood-brain barrier, granting direct access to the brain. Once inside, the TSCs followed chemical signals toward the damaged visual cortex. There, they began to differentiate, linking together to form new branch-like connections. By delivering regenerative cells directly to the central nervous system without surgery, the researchers aimed to bridge a neurological gap that had been dark for 13 years. This chart tracked the patient's visual progress. Her baseline was panel B, total absence of light. After the first treatment, she saw a fuzzy black spot on a dark gray background, panel C. After the second, the black shape gained distinct borders in panel D. This was not an overnight return to 20/20 vision. The patient remains significantly impaired. However, for a patient who spent over a decade with no light perception, the ability to distinguish contrast and define shapes is a milestone that standard medicine has been unable to reach. By utilizing their microscopic size and regenerative potential, actively repairing biological pathways that were non-functional for over a decade, they are proving that even chronic neurological damage can respond to the right cellular intervention.